Hello and welcome to this Research in Progress webinar on accessible housing needs in Canada. My name is Sarah Lewis, and as the Strategic Communications Manager at the Balanced Life Housing, I'm very excited to kick off this timely webinar on accessible housing needs and barriers to accessible housing with Doctors Alina McKay, Colin Phillips, and Jeremy Wildeman. We are hosting today's webinar from the stolen territories of the Musqueam, Squamish, and Tsleil-Waututh Nations in so-called Vancouver. Indigenous people are disproportionately impacted by housing inequality as a direct result of colonial violence. And so we encourage you to consider where you live, work, and play, and how the land stewarded by Indigenous people longer than written history plays an important role in your life. For those of you who are new to these webinars, the Balanced Life Housing is a research node focused on addressing the need for the right supply of housing in Canada's urban centres of Toronto, Montreal, and Vancouver. Led by Dr. Alexandra Flynn, we are a HRREC CMHC-funded project housed at UBC's Peter A. Allard School of Law, where we support over 45 research projects focused on reshaping the financialization of housing, innovating in responsive land use practices, and designing sustainable housing futures. Before we begin, a quick note that this session is being recorded and will be available on our website in the coming days. With that, let me go over a few housekeeping items. Please use the Q&A function to submit your questions. We'll dedicate time at the end of the webinar for discussion with our presenters. You can also use the Q&A section if you have any technical issues, and we'll reach out directly to support you. To read along, you can enable the live captioning by clicking the CC option below. You also have the option to translate captions into another language of your choice. We have also opened up the chat for this particular webinar, and we encourage everyone to introduce themselves. For those of you who would like to engage in the chat, please ensure this remains a welcoming, safe, and respectful space for everyone. With that, let me introduce our speakers today. Dr. Jeremy Wildeman is a political economist whose research focuses on housing precarity, inequality, and the right to housing in Canada. He is currently leading a study examining the right to housing for people with disabilities and is a co-investigator on a major HRREC partnership grants, including new housing alternatives and a safe and affordable place to call home. His work combines critical policy analysis with applied research to advance more accessible rights-based housing systems. Dr. Alina McKay is a housing researcher and the research manager for the Housing Research Collaborative and Balanced Life Housing at UBC. She completed her master's in sociology and PhD in population and public health at the University of British Columbia. Her research focuses on the links between housing, security, and well-being. In her role as the research manager at the Balanced Life Housing, she helps coordinate collaboration between BSH's academic and community-based researchers. And Dr. Colin Phillips is a policy professional and educator currently working at the School of Social Work at the University of British Columbia and Toronto Metropolitan University. He spent his career finding solutions to the homelessness and housing spent his career finding solutions to the homelessness and housing insecurity crisis that the most marginalized in society experience. Colin is particularly interested in the affordability and financialization of rental housing, advancing the right to housing and harm reduction, and drug policy reform. A registered social worker in BC, he operates Rowan Tree Solutions, where he provides critical research and strategic advice around housing and other issues that are central to economic and social justice. With that, let me hand it over to Jeremy.
Thanks, Sarah. I guess you need my voice to have me speak. Thanks for hosting me on the Balanced Supply of Housing series to talk about our important research. If I start off with a smile, I have to laugh. Despite the image of the three of us, we're not in a folk band together. I like Colin and Lena quite a lot, but we've never sung together and we've never been in a tabernacle together or whatever would be the appropriate term. But speaking seriously about a really challenging research that we're undertaking with the Canadian Centre for Housing Rights, where I'm a research consultant, was previously the research director. We're looking at the right to housing for disabled people in Canada. And I'm going to use, you heard Sarah refer to the project as people with disabilities. We use both identity first language, so disabled people, and person first language, that is people with disabilities. And we know this is contentious in disability communities, but identity first language So disabled people is generally preferred by contemporary disability activists as it places the focus on societal barriers. So disabled people are disabled by society. Some other folks prefer to use person-first language, so people with disabilities, and this is quite common for people labeled with intellectual disabilities. We use both terminology throughout our project. Ourselves, we tend to use more of the identity-first language, so disabled people. So that's what you'll see. Now, I'm going to talk about our research in relation to the CRPD. Boy, I wish I was there with you in person to ask you. This is where I jump in and ask you the question, what is the CRPD? Well, it's a legally binding convention on the rights of persons with disabilities. This is a United Nations convention. It's legally binding because Canada ratified it in 2010, committing to uphold its provisions. Now, the CRPD promotes and protects the rights of persons with disabilities, and Canada is responsible for ensuring these rights are respected and implemented within its laws. If you say, well, I'm in BC and the federal government signed it, the federal government signed on your behalf, we can go into a whole political science course if we want to talk about that. And you can see from the title of the slide, A Promise Unfulfilled, how well Canada is doing with implementing the CRPD in Canada. Provisions include the right to live independently and be included in your community if you have a disability, the opportunity to choose your place of residence, access to residential and community support services, and access to community services and facilities. The scale need in Canada is enormous. At least 8 million people in Canada require affordable and accessible housing. Supports to remain housed, including income supports to sustain tenancy arrangements, and fair adjudicative processes surrounding eviction. We'll get into eviction throughout both our presentations. Now, this 8 million people represents about 27% of the population aged 15 and above. Sorry, the people who require supports. Part of addressing the CRPD and part of addressing housing broadly in Canada has been the National Housing Strategy Act. This is legislation from 2019. It mandates that the federal government develop policies aimed at eliminating homelessness and ensuring adequate housing for all Canadians. We know how poorly that is going. That has been going since 2019. We ask this not in the, and what we've seen is that for disabled people, they face even more housing insecurity rather compared to the broader population. And so one of the questions that's emerged for us as we've done this research is, what is the value of a disabled person's life in Canada? So it's a really hard question to ask. And I will say that as a team, largely of people working on this from the point of view of lived experience. So our team consists of disability studies specialists. I myself am more of a political economist, but I'm working with an outstanding team, largely of disability studies specialists. Researchers with lived experience, housing rights specialists, community partners, academics, and the lived experience participants themselves in the project who at points helped us shape the project. We worked on 4 case studies. We know this doesn't encompass all of Canada, and even within provinces like Ontario, one of the case studies, it is a large province with great differences in the province. Well, you folks in BC know the big differences within BC geographically as well and how people live. Also, we've looked at Manitoba and Nova Scotia. This project is funded by HRREC and actually also by the CIHR, and it's a special race, gender, and diversity initiative grant. There's 4 main types of data collection we've done in this project. We've done actually a lot of activities that you could be considering data collection, but this includes semi-structured interviews, 25 with people with lived experience in the 4 provinces, and 10 service providers. We've also been running focus groups in each province of about 5 to 10 people, 1 group per province. We will be running a survey in March, looking for feedback from people in the 4 provinces. We're going to look at surveying hopefully 250 people. We've also been looking at documents, a review of gray literature. And gray literature is kind of like these, it's not the formal academic literature, but rather like government reports, NGO reports. We've been looking at this for each province back to the early 2000s, further back if we can, just get a sense of to what extent each province is responding to the right to housing for disabled people. And we're writing up each of our analysis of these, by the way, into white papers, and everything is going to be on our website. And we have some data, some analysis already up, and we're going to share the web link at the end of my presentation. What I'm going to focus on is the interviews. So to investigate this crisis, we conducted in-depth interviews with disabled people with lived experience of housing insecurity in the 4 provinces that we're looking at. This was challenging. It was challenging to listen to the problems and traumatic life experiences of so many of the people. I'm complementing this presentation too with another study we ran that did some supplementary, or I'd say complementary, analysis. This was a study measuring discrimination in rental housing across Canada, and the study provided statistical evidence of discrimination against renters, not just with disabilities. We looked at a few different groups, but it included people with disabilities. And this was produced by CCHR, Canadian Centre for Housing Rights at Brock University, and we used another HRREC grant to conduct that last year. Now, here's some of the emerging themes, the preliminary findings in our project, and these include that poverty and a lack of resources are a predominant, not unexpected, but predominant and troubling theme. Similarly, ableism and being discriminated against came up regularly in our research interviews, and it's coming up in our other research as well. Disabled people have told us about living in unstable, inadequate, and dangerous housing that did not meet their needs. And they speak about social isolation and a lack of community. I'm going to share with you some of the quotes. These are all anonymized. This first slide is a couple of quotes from our interviews looking at that sort of address poverty and the limited options that people then have for housing. And I'll note that although not all disabled people are poor, there's a higher chance of poverty amongst people who have a disability. So one of our anonymized respondents said, "I won't live so long, so honestly, given my chronic diseases and the state of my health and the fact that I have to live on $200, $300, this is euthanasia, basically for us who are at the bottom of the society." And I'll just note that euthanasia comes up a lot in our research, or this idea that you're being driven towards not being part of society or not being even alive. Another one of our anonymous participants said, "I don't have much choice. I could end up in the north of the province," this is in BC, "like far away from transportation in a smoking building with worse sound and no backyard, so I could end up worse off. So you're really limited in what you can do. So settling for what you can, it could be worse, but it's really not adequate, the housing." We heard a lot about inaccessible and dangerous housing. This is where I'm getting at to with that, building on that last slide. There's such a small pool of accessible housing. It's hard to find accessible housing and accessible, affordable housing. So it might be accessible, might not be affordable. And it was a lot of filling out a lot of applications and being on wait lists, and again, trying to find housing that is subsidized, which makes it affordable and accessible. It's a hard thing to do. This was in Manitoba. Now, another anonymized respondent, interviewee, Ellen in Nova Scotia. "It doesn't matter where we go. 1, I can only afford a bachelor, and 2, all of them are overrun with bed bugs and cockroaches and those little teeny tiny ants and mice. I could deal with the mice as a blind woman. I can't deal with the bugs. I can't see the bugs. And when I can see the bugs, they're big. I shouldn't be able to see those bugs." Most interviewees shared experiences of disability-related bias. John in Ontario. "I was being discriminated against. Landlords were not renting to me because I was blind. Some of them were just saying that they wouldn't rent to me because I was blind. People were saying things like, oh, they were worried I was going to fall down the stairs or the place might not be safe for a blind person." I'm thinking, okay, well, it's not safe for a blind person. What is it safe for? Adrienne in BC, "For the most part with housing, I don't really think to ask the landlords to do anything because even though we have rights or whatever, I don't want to rock the boat. They have so much power over us too. So no, I didn't ask for them for accommodations." And so there's a couple of, I'm talking about that complementary research we did at the Canadian Centre for Housing Rights with Brock University, that we found there was already discrimination against people as they applied for housing. So we did paired testing where you would reach out to landlords inquiring about a possible rental, and we'd log how what the response rates were for different groups. And this was compared to the sort of like the standard white male um, control. And disabled renters received a response about 8% less often than non-disabled renters. So you were close to almost a 10% of the less likely to get a response about renting. We found incredible discrimination during tenancy compared to non-disabled renters. Disabled renters were these figures were astonishing. 67% more likely to face different rules. So thinking about those slides where the renters were about being afraid to rock the boat about accommodations. 317% more likely to experience landlord aggression. Imagine that. That's horrific. 20% more likely to have their boundaries violated. All three interrelated issues. Going back to our main study, to our interviews, some participants experienced additional forms of discrimination because we all share multiple identities. Even if landlords, this is Robin in Manitoba, even if landlords don't mind employment and income assistance as my main income, if I tell them I'm trans, that's just another reason that they might have to say no to renting. Ada in Ontario, do you really think someone in your condition will be able to meet up with payments consistently? This is her speaking the voice of the landlord. And I'm like, okay, which condition is he talking about? Is it my skin color? Is it my chair? There's a feeling of social isolation, varying degrees of social isolation were common experiences. This is Olivia in Ontario, again, anonymized interviewees. My friends are all in their 70s or 80s. They can't come and visit. They can't get up my stairs. So again, more isolation because I'm inaccessible. It's not just that the bloody place is inaccessible. I'm inaccessible. Canada faced actually an international rebuke on a visit to Canada by the UN Special Rapporteur on the Rights of Persons with Disabilities. This is back at the end of 2019. They signaled that in Canada, access to sport seems not to be considered a right, despite signing the CRPD, but rather a social assistance program that is dependent on availability in funding. They highlighted that the National Housing Strategy's role in fulfilling disabled people's right to live independently in the community, that it should be supporting this, and that the NHS targets to increase the number of accessible housing units, but that this NHS plan will not lead to systemic improvements without adequate income supports and services. So even if the NHS just targets a certain number of housing being built, it's not enough, that there needs to be more support than it's not just build, build, build. Sometimes in the housing, when you hear build, 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 reminds me of Donald Trump saying, drill, baby, drill. It's not the only solution. What we feel in the project is there's a systemic devaluation taking place. That is a question has emerged for us. What exactly is the value of a disabled person's life in Canada? The answers we heard are devastating. When your income is so low that you must choose between your health and your housing, when the only place you can afford makes you sicker, the line between poverty and slow death begins to disappear. And that's where we hear these instances talking of euthanasia. And this is exacerbated by the financialization of housing, a human-made crisis. And financialization of housing, it's a big term, but it refers to the process where housing is treated as a commodity for investment and profit, not a basic human right. And this is driving the broader housing crisis in Canada. It's impacting people who are disabled more than almost any other group. And really, we have to trust ourselves. Almost every group is suffering in Canada from this financialization of housing and this false economy that's been created around housing. For disabled people, this is not just a crisis of housing. We feel it's a crisis of societal devaluation. So the call to action is to revalue disabled lives. Housing alone isn't enough. We must actively dismantle the social isolation and lack of belonging that disabled people face. So we need housing that is integrated in with the community. This requires a collective societal shift, a commitment to revaluing, not devaluing disabled lives. And I'll just think about the CRPD, go back to again, I keep wanting to say it's CRDP, forgive me if I ever make that mistake. How we're doing with the requirement Canada has signed as a treaty versus the reality. So the requirement is the right for disabled people to live independently and be included in the community. What we're finding is that they're isolated and abandoned by a lack of wraparound supports. And wraparound supports is broadly in housing referring to comprehensive personalized services designed to help individuals and families address various challenges related to housing stability. And it's a little bit more comprehensive than support for disabled people, though not always so much. And everybody needs supports in different ways. So it's still an area where we're not counted as doing very poorly at. Requirement is also that there's the opportunity for disabled people to choose their place of residence, not just be pushed off to wherever they can hope to survive. And what we're finding is that there's no choice, limited by poverty and discrimination, let alone if the housing is accessible. Access to residential and community support services, we're finding they're underfunded, inadequate, precarious, and we're getting a feeling, you get a feeling again amongst interviewees that they feel that they're unwanted in the community. And the requirement about an access to community services and facilities, in general, finding that they're inaccessible, far away, or non-existent. So let's think about a path forward. Go from research to action. I'm not a big fan of doing research in a pilot way. We have to do research that actually has an impact. Why would be doing the research otherwise? And you need to confront the root causes. And part of the confronting the root cause is challenging financialization. Housing is a right, not a commodity. We need housing for people to live in, not just to make money off of. It's a shift in mentality. We need to revalue disabled lives, which have been devalued by financialization. This broader idea that you're not contributing properly to the economy and paying for this expensive housing, then what value to have in society? And then this devaluation takes even a further move forward for disabled people in Canada. We need to fulfill the requirements of guaranteeing adequate lifelong supports. Housing needs to be accessible, safe, and affordable. Accessibility and affordability have to go together. And there needs to be a demand for transformation from people in Canada. We need systemic change in Canadian policy, law, and culture to actually meet the needs of housing for everybody, folks, and for disabled people. We need to pay extra attention to this basic right. So I want to say thanks. We have a lot of time for Q&A. I'm looking forward to Alina and Colin's presentation to build on this. I want to say thanks, though, to HRREC and the CHR for funding our research, to the research participants that have been informing the research, fantastic team of research assistants and researchers I'm working with, and the Canadian Centre for Housing Rights for hosting and running our project. And I'll thank you for listening. I'm going to put the website in the chat. And there's a QR code here, which you can also scan right now if you want to go to our webpage where we talk further about the project, and we keep posting fairly regularly. I'd say every month we have 1 or 2 outputs coming out right now related to the research, because we're winding down the final data collection analysis, and we expect to launch the project findings in September. And just a little blurb for the Canadian Centre for Housing Rights. Thank you so much.
Thank you, Jeremy. Great presentation that really sets us up well for our survey results. So just a moment here. Can everyone see my screen? Good? Okay. So I just see a second here. So thanks, Jeremy. Moving into our presentation today, we will be talking about our survey results from a survey that Colin and I put together in the fall of 2024 and into 2025, and that was rolled out in the summer of 2025. So today we're talking about housing experiences of persons with disabilities, so the results from that survey. So starting with an overview, we're going to be talking about so assessing housing needs, how we assessed housing needs, the overview that we use the framework for thinking about how to actually identify what housing needs were, our data cleaning process, the demographics of our survey participants, the experiences that they had accessing housing, living in housing, and some of the limitations and implications of the research. So starting out with how we were thinking about assessing housing need, we were really coming at this from 2 directions. The first was around core housing need. So we we're looking, CMHC has used core housing need as the main way of identifying housing need within Canada. And specifically, this really ties into the need for social affordable housing. So housing that has some sort of government subsidy. So whether it's municipal, provincial, or federal funding, recognition that people are might be in a position where they're unable to afford their housing and need additional support. So core housing need looks at affordability. Affordability is specifically defined as the household spending no more than 30% of their household income on their housing costs. Adequacy is measured by whether or not the household is adequately housed, which is around whether there's major repairs that are needed. And suitability is around whether there's the number of people matches the household unit. So for example, one bedroom would be appropriate for a couple according to national occupancy standards, where a mother and child would be unsuitably housed according to those standards. And what the core housing need is a really helpful tool. It's important to note that it actually doesn't tie or in any measures of accessibility. So there's no measure of whether the housing is actually meeting the household's needs and whether they have accessibility needs that are unmet. This is where we then turn to the UN right to adequate housing. So UN right to adequate housing brings in quite a few additional measures to core housing need. Security of tenure is a really important one. Jeremy's touched on the fact that, right, whether or not you can depend on your housing and know that it's going to be there for you in the months or years to come is really important, whether you have an affordable, safe space to live. And we know that from our research and from other work that we've done at the Balanced Supply of Housing, that security of tenure for renters specifically is not very high in Canada. So our rules and regulations around renters' right to housing are relatively weak. Landlords have a lot of power to say, for example, I'd like to move into this unit next month, really bringing into question security of tenure. The UN right to adequate housing also looks at availability of services. So is housing close to services that people might need? This is especially important for folks with disabilities, where services are going to be incredibly important to whether or not you can get to your appointment, or you can get to the service station where you might need to access to get say like additional supports. So availability of services, affordability. Here again in the survey, affordability is less well defined, but we use the CMHC definition, which is that 30% of household income. We also it also looks at habitability, which is similar to adequacy in the core housing need. So habitability again is around whether the house is in good repair, right? Is there a hole in the roof? Is the plumbing working? Those kinds of things. There is an accessibility measure in the UN right to adequate housing. So this is really looking at whether the unit's accessible, right? Can people get in the door? That's often a key barrier for many people with accessibility issues. Is there a visual fire alarm? Are there emergency measures? Is the unit designed in a way that actually meets people's needs? Location, this was also touched on in Jeremy's presentation, but location is incredibly important to people, right? Are they close to their community, their family, their church, their loved ones? Is there housing that meets their needs, that is located centrally to those key support networks? And then cultural adequacy, which can be more challenging to define, but is often around those, again, cultural supports that have to do with elders, with spiritual community, with family, and being able to practice your language and your different aspects of culture that can be very important to well-being. So those are that's the framework that we were drawing on for the survey. So we started once we had that framework, we developed a question bank. So we looked at different surveys, and we wanted to do something different. So we really brought in as many looked at those different surveys. Were they answering the questions based on that framework that we had identified? And then we also looked at this through access to housing. So what were the challenges that people were facing when they were actually looking for housing? Could they find housing that met their needs? living in housing. So once people lived in housing, was it to what extent did it meet their needs? To what extent did it not meet their needs? And then finally, moving from housing around evictions. I will note that we don't actually touch on the moving from housing in this presentation. We'll get into it, but there was some methodological issues that make it difficult for us to speak to that specific issue. We then, once we had that question bank, we held a workshop with persons with disabilities. So 16 people participated in 3 different workshops where we got feedback on the questions. And that really led us to revise the survey. So in those workshops, it was really clear that participants that owned versus rented versus lived in social affordable housing or co-op housing had very different experiences. So someone that was an owner and had experienced maybe discrimination from a real estate agent, that was a different experience than experiencing discrimination from a landlord. The dynamics of that were different. And so we felt it was important based on those workshop results to really ask the different questions that need to be asked based on tenure. And then again, we shared the survey online between June and July of 2025. So we presented on this on a previous presentation, but just as a refresher, our eligibility was folks that were living in Toronto, Waterloo, or Vancouver. They needed to identify as a person with a disability or be assisting a person with a disability, and they needed to be 19 years or older. And so we focused on Vancouver and Toronto just because those are BSH's key urban centers as well as Montreal. But there were, when we actually reached out to so many different disability rights groups and housing advocates in the different provinces. And Montreal, when we were talking to folks, it was really clear that there was just a different set of supports and services in Quebec. And so also with the language difference, we felt that it wasn't really a great comparison, where Toronto and Waterloo, where Colin had some community connections, we felt that there was a better comparison to be made between those communities. So data cleaning, we had over 800 survey responses. However, unfortunately, the data was very messy. So this was a major learning lesson for Colin and myself, as well as our research assistant, Eli. So approximately 95% of our survey responses when Colin started to go through them were from bots. And really, what Colin looked at to assess whether we thought this was a real response or a false response, we looked at IP address. So when IP addresses, that's the address of where the survey respondent is actually coming from. We had so many responses that were coming from outside our study area. So again, Waterloo, Toronto, and Vancouver. We had folks that were logging in from southern states and things like that. And while that might be understandable if someone's using a VPN or something like that, when those were paired with nonsense responses, so for example, symbols or information that just didn't make sense, sometimes there was like random copy pasted like very odd responses that just didn't make sense in the context, right? It was a rainy night and I was walking down the street, and you're like, what does this have to do with accessibility? Like, just very random. So when those IP and nonsense responses, we would, Colin would say like, okay, this is not a real response. And then also Colin also looked at how long it took the respondent to respond. So this was a long survey. We had a lot of questions in it. That was also another learning piece that Colin will touch on at the end. So when we saw that someone had taken 10 minutes to respond to 50 questions and half of the questions weren't actually responded to, that was also flagged. So after Colin went through, we started by using filters, and then it was really clear that our filters weren't working. So Colin actually went through these 800 responses individually and cleaned that data, and very thankful to him for that. So we were left with 45 survey responses after that process. Just a little overview of our respondents. So you can see here a breakdown by owner, renter, and non-market housing. We did actually end up adding co-op people, folks that were in co-ops to the non-market group, just because we only had 2 co-op respondents for a total of 14 respondents in the non-market group. So you can see here, right, about 12 owners, 19 renters, and 14 non-market housing respondents. And then in the cities, we have about 17 from Vancouver, 20 from Toronto, and 8 from Waterloo. Finally, my last part of this presentation before I hand it over to Colin is just around household and income tenure by tenure. So you can see the distribution of the different respondents and different groups. The yellow bars show owners. Owners are generally have a higher household income than other respondents in the survey, right? So you can see that on the sort of median so the group that had the most respondents was that income between 45 and 72,000 for owners, generally higher than we saw in renters and people living in social housing or non-market housing. So those green bars are showing renters. So the most number of renters were really in that 18 to 45,000 household income range. And then we see social housing really falling within the two lower income bands. So making either less than 18,000 or between 18 and 45,000. And then we have one household in social affordable housing that's making over that 109,000. So with that, I will turn it over to Colin.
Thanks, Alina. So, hi everyone, this is Colin's attendant speaking, and I'm here just to facilitate any communication on Colin's end. I'll be presenting off of some notes prepared by Alina and Colin. So today I'll be talking about some of the most striking survey results. These findings are things that really jumped out to me when I was going through the analysis. Our first section of questions asked people about their experiences accessing housing. It's important to note that overt discrimination was experienced by all three tenures: owners, renters, and people living in not-market housing, and everyone we spoke to reported barriers to housing. As one respondent reported, there were no level entrances and the doors weren't wide enough. The realtors we encountered weren't very friendly or aware or even sympathetic. One even said that accessibility renovations like replacing a tub with a wheel-in shower would degrade the housing, and no one wants to buy a house without a tub. I also identify as a racialized person, and I must say it was very difficult. This is an example of how real estate agents consistently lack knowledge of accessibility issues. Furthermore, they were often unable to recommend accessible properties to their clients. This also came up in our focus groups, where it was recommended that properties listings have standard accessibility information. Knowing that a building used universal design standards or other accessible building codes has the potential to help people and their realtors find housing that is a good fit for their needs. People living in non-market housing reported similar issues. The application process for non-market housing units often failed to provide accessibility information about individual units, leaving people to accept housing that did not meet their needs. The threat of being put at the bottom of the list was often used to leave people feeling like they had to make the choice between homelessness and inaccessible housing. As one respondent reported, "I applied for accessible housing in Toronto so I could move to a more accessible community. The application form let me identify the physical disability. No information was made available about the accessibility features in each apartment, and there was no option to list what my needs were. This meant I had to guess at a location, wait until there was a vacancy, view it, and if it wasn't accessible enough, reject it." This respondent went on to wait 8 years for accessible housing, only to learn that the person that had given them the forms had failed to provide a form that would have added them to a waitlist for wheelchair accessible units. Another respondent reported, "I required subsidized housing and was basically sent a video of an apartment that was not accessible, but on a main floor. I was told if I didn't take it, I would go to the end of the list." After moving into the unit, this respondent had to remove the door to their bedroom in order to get their electric wheelchair into it. There were also reports of significant harassment and providers minimizing tenants' reports of these threats. So we also asked questions about the types of discrimination that people experienced. Alarmingly, 89% of renters reported discrimination based on their disability while applying for housing. Looking at the breakdown of how this plays out, almost 50% of renters reported that they were refused housing because of their disability. This is compared to just 17% of non-market respondents. These questions weren't asked of people that owned their homes as they didn't apply. All tenure types were asked about whether they experienced discriminatory comments when looking for housing. It is noteworthy that more than half of respondents that lived in non-market housing said they had experienced discriminatory comments. Furthermore, more than 1 in 3 renters reported that they had to go through additional background checks because of their disability, and 1 in 4 reported that they had to pay additional fees to secure the unit. It should be noted that under Ontario's RTA, landlords cannot legally ask for a damage deposit, security deposit, or cleaning deposit. But in BC, damage deposits are capped at 1/2 of the first month's rent. Now let's move into respondents' experiences living in housing. We asked participants to rate the degree to which their current housing meets their accessibility needs and the overall accessibility of the unit. Although there are some variations between cohorts, it is noteworthy that all of the mean scores are relatively low, as this graph illustrates. So just over half of renters and non-market respondents were satisfied with the overall accessibility of their unit, while slightly more owners reported that they were satisfied with the accessibility of their housing. Scores were also relatively low for the extent to which housing met people's accessibility needs, with an average score of between 60 and 70%. This should be a cause for concern, as this shows that many people have outstanding accessibility needs. I can give a more personal example as well. I would likely give my unit a score of around 70%, given that it's a ground floor unit with a number of accessibility features. However, it's also an older unit without some basic accessibility features like an automatic door. You can see from this example that a score of 70% likely leaves room for improvements to the accessibility of the unit. And we did ask people about their ability to make the modifications they wanted to. This was particularly illuminating. So amongst those who own their home, only 1 participant has been able to fully implement necessary modifications. 5 participants have partially implemented modifications, and another 5 have been unable to do so. Of the 11 participants in the renter cohort who answered the question, none have been able to fully modify their home, while 7 have had partial success, and 4 people were unable to make any changes. Of the 8 participants in our sample of non-market respondents who require modifications, 3 have successfully modified their home, and another 3 have had partial success, while 2 reported that they were unable to implement the changes they needed. In providing the reasoning for why people weren't able to make the modifications they needed, we had limited answers, but they still provide insights into the different experiences. For many respondents, it came down to the cost. As one owner succinctly put it, no money. There were also restrictions to the changes that people were allowed to make. This was the most common response among renters, including the renter quoted here that reported, "I'm not allowed to drill into the walls to install grab bars in the bathroom according to our lease." Finally, one of our non-market respondents pointed to the application process that can be part of the process of requesting repairs. Community approval isn't necessarily a bad thing, and in some cases it can come with financial support, as one of our workshop participants reported. This brings us to some of the lessons learned during this process. Alina's already touched on the huge number of hours that it took me to clean the data. This could be partially fixed by using individualized survey links and sending the survey to trusted organizations for dissemination. Also, avoiding mention of an honorarium may contribute to fewer false responses. Furthermore, the number of questions in our survey made it long and difficult, meaning that there were a number of areas where there were non-responses. Choosing a specific area and scope, such as the changes that people face accessing housing, would have likely led to better results. Finally, we connected a number of different surveys together in the back end, which contributed to challenges comparing across different tenure types. In the future, it would be better to keep all of the responses in the same survey. This brings us to the final implications of the results that we'll be working on in the coming weeks. Mainly, these findings point to the need for standards to be in place to ensure that real estate listings include accessibility features, Real estate agents should also receive training on accessibility features, including safety and design features. Non-market housing units should have clear accessibility markers that are comparable across jurisdictions. There should be a clear mechanism for reporting landlords that request a deposit and fees for landlords that break the law. And a lot of this comes down to the fact that we don't know how much accessible housing there is in Canada, and there aren't good ways of tracking it and matching it to people's needs. Some of this could be addressed by starting to track basic accessibility measures, including units that are built with universal design principles and units that have accessibility features, and making that information publicly available, whether for people looking to buy or rent housing or needing to access non-market housing. And with that, I'll say thank you for your time today and open it up for questions.
Thank you so much, Alina and Colin and Jeremy, for your presentations today. We have many questions, so let's get right into it. Our first question is from Jody Negley, and this is for whoever is happy to answer. Is there any potential for legal recourse, injunction, class action, charter challenge against the federal government to ensure that programs like Build Canada Homes make universal design the standard in all new housing construction in order to receive public funds? If yes, what steps need to be taken? If no, why not?
Maybe I'll jump in. CCHR does working with that who I'm working with on this project does participate in a lot of legal challenges like this, and I'm going to speak from a different perspective that I'm a little bit more pessimistic about the change of relying just on the courts. We can see that Canada has subscribed to the CRPD as a UN convention, as this is legally binding. The challenge is how that is interpreted, and I think this is where in my slides I refer to you need a shift in how people are perceiving housing and perceiving the economy and valuing people's lives, and that will most surely come through policy change. So rather than, I think there's two things here. One is you can go to the courts and you can challenge this, but probably more important is using data from our research, so it's evidence-based, to actually go to policymakers and say, look, we have to change this, and this starts at the grassroots level. It can start at the municipality, start in the community, and build your way up. It can be in a school board even. But we need to push people to make change both in how you fund programming, and we can see this right now in Canada, right? We're making a major shift towards defense spending away from other areas. So how you fund programming and how you value people's lives. And this needs to be driven by that discussion, not just relying on the courts. This is my own opinion, but I'm not dissuading from making that challenge. It would be something worthwhile doing, and I can't remember if anybody's actually doing that. It's just less reliable than the hard part, but the important part, and then again, using this evidence-based research to get policymakers to actually make change.
Thank you for that. We've got a connected question, so I'll kind of tag this on here. This is from Carleton University. Can any of you comment on the quality and quantity of federal or provincial grants or financing for accessibility retrofits?
Carolyn, good question. I'm not following it closely. I've seen some funding. I don't know, like I'm just going to jump in and say I'm not quite sure. I'm not following that close enough on the accessibility side. I don't know if Colin and Alina are, or if anybody else is that they could answer that question a little bit better.
It was definitely something that came up in our workshops, but yeah, it wasn't something that we can speak to directly either. I don't know, Colin, if you have any insights into it.
It comes up
if you're trying to read Colin's remarks, you're on mute.
Apologies. So all I can say is for the for the owners of the federal and provincial grants, fund, funded, yes, some of the some modifications, but the vast majority of funding was yes I savings or R E or RDSP.
Thank you for that, Colin. Jeremy, did you have something to add?
Oh, I just noting for Carolyn that I posted a analysis of the grey literature in Ontario we did on the government reports and municipal reports, provincial, federal, affecting Ontario, and some discussion of modifications comes up in that. But again, I'm just noting that it's not something we've been specifically looking at yet, at least at this stage in our data collection analysis.
Thank you for sharing that. This is a question from Kirsten Yuzwa. And they asked, did any of your qualitative findings include discussions around people not having their basic needs met and who have considered or applied for track to MAID? For example, did you find any links between the right to adequate housing for people with disabilities not being met and to access the medical assistance in dying that you will be making within your research findings?
We're actually going to address this specifically. We're working with Professor Nancy Hansen, does a lot of work on MAID, and MAID has been coming a lot in our research. So you'll have to wait for that. We're probably going to write that in the summer and towards the end of our analysis on our project. But euthanasia and MAID has been a significant part of our research project. The discussions keep going back to it. Professor Nancy Hansen, sorry, at the University of Manitoba, who works in disability studies, and this is one of the areas of her core concern.
Just to add to that, I made a I did not come. Just to add to that, MAID did not really come up in our survey results. Once. Oh, it came up once. Oh no, it did not come up at all in our survey results.
Thank you for clarifying that. This is a question from Steve Arnett, who is a very curious participant today with many questions for us. This one's for Jeremy. He asks, were there any participant percentages of the sample who are Indigenous? And for the entire group age cohorts within context of type of defined disability. From a personal perspective, they speak to their brother's passing because of a bedbug infestation and the stress of it. And these situations add to an already precarious housing circumstance, especially in Winnipeg. And it's a primary issue for the advocacy sector. The question is, what are your thoughts on how to address this municipally, provincially, and nationally?
Yeah, and in Manitoba, it's one of the issues, like the older stock of housing is what's affordable, and then this is the stock of housing that people with disabilities end up living in, because as most of us will know, disabled people tend to have lower incomes. They also face discriminations in workplace and environment, so it can be harder to have an employment income that meets the housing needs, and then this compounds all the issues, let alone lack of wraparound supports and income supports. So just very briefly, it was a bit of a long question, and I went on a bit of a tangent there already about the housing in Manitoba. I know you said something about change. What was the other point, Sarah, at the very beginning? The question?
I think it was around the elements of
Indigenous.
incorporating the Indigenous population into the
So
survey.
there's two sort of weaknesses in the study, and it's not really weaknesses, it's areas to address going forward. We do have Indigenous participants who will participate, but just because of the nature of the study, we haven't worked specifically with Indigenous communities. And I'm going to mention that because it's something that Sarah and I talked about, just some limitations in the methodology when Sarah did fantastic work sitting down with me and going through the presentation earlier. And if there was any imperfections, that's on me, not on Sarah. What happened is we have two communities that we'd really like to work with going forward, French-speaking communities, so specifically in Quebec, and Indigenous nations, and particularly in the north, but not just in the north. So that area, it's very important, but we'll want to look at a future study partnering with an Indigenous partner to carry out that research. For Quebec, one of our team members is a professor at the University of Laval, so that will be something we look at going forward as well. There's a lot of research we want to do out of this. First priority is getting the research done. We're almost there. I'm going to quickly note Alina and Colin's issues with surveys. It's really good to hear from their experiences because we're about to start our survey and we've been thinking through already a lot of these solutions you came up with. Also, we have to watch out for AI. AI is getting really good at answering, getting past even like there's companies out there that conduct surveys, right? And they create systems to try and stop AI. AI is just getting too clever for the responses. At the advocacy level, it's not an easy answer, is it? And I do advocacy in a lot of different areas in human rights. You have a little bit more of an opportunity with Manitoba than you have in the past. And I'm going to note, I shared the gray literature. Actually, it's really interesting. I'm going to share with you in the chat. We already did our gray literature review for Manitoba, and we actually looked at about 40 years of research. And you do have a situation that's very clear in Manitoba that when you have an NDP government, they're going to be more responsive to disability rights and housing. And when you have a conservative government, much less so. I think our website's a little bit slow because people are actually accessing it more than normal at the moment because I'm trying to get to the link. I'll share it. But you might find that useful to build on because we looked at, and we hope to keep building on it. And I'm going to note like that we're creating an annotated bibliography that we're going to put online around April or May. So other researchers can build on our research and see what gray literature reports we've looked at. But you can definitely see an opening right now with the Wampanoag government. It's an easy answer, right? It's like just there's an opportunity. How you affect that change, it's going to be challenging. I mean, use our evidence. Our project, we're specifically looking at Manitoba, other people are looking at Manitoba. This is just part of the process. How do you advocate for change is multiple steps forward. Maybe even a bigger discussion we could have, and maybe something we could do at the wrap up, because we don't mind doing provincial wrap up, sort of provincial specific meetings with folks. So if you want to email me, like I'd love to be in contact, and we could even talk around September when we launch all the findings and maybe how could we specifically work with you there. CCHR will be doing some advocacy work based on our research, and one of the team members, Utaka Dirks, is in Winnipeg, so it could be interesting to work together in that regard. Sorry, it's not in. I wish I could have a simple answer.
That's quite all right. These are very complex issues and questions to be able to tackle. Unfortunately, we are out of time, and so I'm going to have to wrap this up. I've noted the remaining questions that we've got in the chat, and so our panelists will be reaching out to the participants who have asked those questions to answer those. Once again, thank you so much for being here today, Colin, Jeremy, and Alina, and thank you very much to Oceania for speaking on Colin's behalf, and to Sheila, our research assistant, for supporting us in the chat. If you'd like to revisit this Research in Progress webinar, you'll be able to find the recording on our website in the coming days, and we encourage you to reach out to any of us or our speakers if you have further questions. To learn more about our research on today's topic or on other thematic areas, please visit our website at bsh.ubc.ca. And lastly, to stay up to date with all things balanced supply of housing, we encourage you to sign up for our newsletter or follow us on social media, links to which you can find in the chat. With that, I wish you all a wonderful rest of your week, and we hope to see you at our next Research in Progress webinar.